name is Randy White. Today we'll be demonstrating the nitrous oxide tanks. Nitrous oxide is used for pain relief of patients with long bone injuries and things like that. You'll note on the PowerPoint presentation that all the indications and contraindications. So we're going to do the skill right now. The first thing that we want to do is make sure that we have BSI. The second thing that we want to do is we want to find out basically a history about our patient, level of consciousness, if he's had anything to drink, or basically do our sample, because anytime that we give any type of drug, we need to make sure that we do the sample, and that we need to make sure that we do vital signs also. So we introduce ourselves, we ask for permission to treat, and then we ask a sample history. On this particular patient, we're not going to have a particular injury, but I will ask a pain scale on that. Okay? And okay, Lee, what's your name?
Lee.
And how old are you, Lee?
40.
Okay. And are you allergic to any medications or anything?
None.
Are you taking any medications?
None.
And when was the last time you had anything to eat?
This afternoon, about 2 o'clock.
Have you had any alcohol or anything like that? Any pain medications or anything like that?
No.
Okay. And then we'll ask about the events, and we'll also ask about pertinent medical history too. So the next thing that we want to do is obtain vital signs. And so we'll use a blood pressure cuff and stethoscope, we'll take his pulse, and we'll take his respirations. And along with his respirations, because we are dealing with the respiratory system, we're going to go ahead and auscultate breath sounds. And as you know, when we auscultate breath sounds, we're auscultating up in here. We use a Z technique because we're comparing left to right here, around to the side here on the very lower lobes, and also right here. Okay? We're also checking for volume, make sure that he can breathe really well. So Lee, I want you to take a good deep breath. Okay? Very good. So I'm looking for chest expansion also. Lee, on a scale from 1 to 10, with 1 being the least and 10 being the greatest, where's your pain?
A 9.
A 9. So the next thing I would do is, after I got his vital signs and after I obtained a history, I would inform him that I would like to give him some nitrous oxide. Has he ever had any problems at the dentist with nitrous oxide or any other type of thing? So Lee, is that the case?
No, no problems.
Okay. So I'm going to call for physician's orders, and I'll tell him his age, and I'll tell them that he has no contraindications for nitrous oxide, that he has perhaps a long bone fracture, or what the case may be, and why I need the pain medication. The next thing that we want to do is prepare the equipment. In this particular version, we have an oxygen tank and a nitrous tank, and we have a mixer right here. Okay? In the newer versions of this apparatus, there is just one tank, and it is a 50% oxygen, 50% nitrous mixture altogether. There's also something missing from this, and that is a scavenger unit, and sometimes the scavenger unit basically pulls back in the exhaled air and filters it back out. So you're not breathing nitrous oxide inside a confined space like an ambulance. Okay, once those tanks are on, and once you have your gauges adjusted, then what we're going to do is we're going to take and put a clean mask on the nitrous oxide. And the important thing to note here is our patient is alert enough to actually self-administer the nitrous oxide. So we're going to explain to Lee, I want you to hold this on, I want you to take good deep breaths, and then you let me know if you're feeling any pain relief. Okay? While he's taking those deep breaths, I'll also put back on my stethoscope, and I will again listen for breath sounds as he's taking those deep breaths in and out. Now, we administer the nitrous oxide until he either feels better or until he drops the mask. And so once that happens, then you are finished with the administration. After the administration is finished, then we have to make sure that we have good documentation. We're going to document his age, his gender. We're going to make sure that we document his indications for use, why we used it, and also who we received orders from to use the nitrous oxide. Make sure that you put pertinent negatives like the lack of contraindications, and also that because this is a drug, we need to make sure that we know how much is in the tank prior to us using it and how much that he has used after we have finished administration. Then what time we began and what time the treatment ended. So all of that needs to be documented and make sure that that is on the EPCR. Thank you.